Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. Today's topic is hip and knee surgeries. And our guest is today Dr. Greg Sirounian, who is Clinical Assistant Professor at Winthrop University Hospital. Dr. Sirounian, welcome to our program.
Thank you.
It's a common problem for especially elderly to have hip and knee problems. Let's talk about first hip fractures. And after a fall, let's say a patient has a hip fracture and comes to you, what kind of evaluation that person goes through?
First of all, hip fractures are very common, and especially in our senior population. Patients with osteoporosis or weakened bones are more likely or are inclined to have a hip fracture at some time.
And more common than knee fractures.
Oh, very much more common, yeah. And typically those patients are going to be coming through our emergency room most of the time. When somebody, say, falls and sustains a fracture or a broken hip, they're not going to be able to walk. They're going to have a lot of significant pain in the hip or the groin or thigh area, and unlikely to be able to get up and walk.
So when they come to emergency room now, they get an X-ray and we have a hip fracture. Sometimes different types of hip fracture comes in. Yes, it can be a neck of the. You go ahead.
That's right. There are different types of hip fractures, and it's really based on the location around the hip where the broken bone is. The hip is basically a joint made out of two bones. One is the femur, which is the thigh bone, and the other one is the pelvis, which forms a socket around the ball or the top part of the femur. And hip fractures can happen either at that ball, the top part of the femur, or even slightly below that. And the location of the fracture and the pattern or type of fracture will determine how it's treated.
What kind of surgery they would have? Because right. Usually it's a neck fracture comes in most of the time. What is the treatment for the neck fracture, the femur neck fracture that comes in?
So the neck fracture, or the fracture that's just below the ball part of the femur, a couple of different options, and it really depends on how significant that fracture is. If it's what we call displaced, or where the ball is actually broken off of the bone, where those patients are typically going to get what's called a partial hip replacement, where we remove that ball, replace it with a new metal ball and stem, and that allows them to get up and walk on it pretty quickly. If it's what we call non-displaced, or sort of broken or fractured in place, but everything is still in good alignment, sometimes we can treat that with just some screws.
And the plate put in, and then the screws come in to fix it.
Right, a metal plate and screws.
In terms of recovery, does it make difference when it's partial hip replacement and because of the fracture and the plate recovery phase?
That really depends on how severe the fracture is. Most of the time, our goal with any surgical treatment is to try to have that fracture stabilized with the implant so that patient is able to get up and walk and put full weight on it early. Sometimes the fractures are maybe a little more severe or what we call comminuted, meaning in multiple pieces, multiple fragments. Sometimes we have to limit their ability to walk on that right away.
Let's talk about the hip replacement now. These are the fall-related injuries that happens to the bones and the bone is broken. Now, the hip replacement comes in the picture when they have severe arthritis and then they really cannot function anymore and they come to you for hip replacement. What are the signs and symptoms that you would say they should have that it's indication for hip replacement?
Total hip replacement patient is that's a different person with really a different problem. And typically they're coming in with pain for perhaps a very long period of time, months, even years. And many times that pain, again, will be in the hip area, perhaps in the groin or the thigh, and it's typically due to arthritis.
Usually it's arthritis. Usually osteoarthritis especially comes in the picture. And it could be rheumatoid arthritis too. But generally it's osteoarthritis.
Osteoarthritis is by far the most common reason.
Right, exactly. So then the replacement, recovery from the replacement, is there any difference from the fracture from falls that happens?
It's generally different. The The process is the same. I think the hip replacement patients, meaning those that are coming in, say, electively with long-standing arthritis, a lot of times we're seeing these patients perhaps multiple times before they have surgery. Unlike the hip fracture patient, which is coming through the emergency room, this is many times it's the first time they've had a problem with their hip. The hip replacement or the arthritis patient has had pain for a long time. Perhaps they've done some research. They've talked to a couple of different physicians maybe, and now they're here for their elective replacement. Now, the type of implants we use are generally similar to what we would use in a hip fracture for a partial, except now we've added a cup. So what makes it a total hip replacement is instead of just the ball and the stem that I mentioned, is actually there's a cup that goes into the pelvis. And now the cup and
both sides are replaced.
So now both sides are replaced. And again, the goal, just like with the hip fracture patients, the goal is to try to give them the patient something that they can get up and walk on right away.
In my practice, let's say, patient comes in and they say, now, because they go on medications first, they go sometimes injections for the hip, right. But finally when they come and they say, my pain is at night too, without any mobilization, and it really interrupts their activity of daily living. I said, then now probably you might be ready for hip replacement. Then there's really the orthopedic surgeon gets into the picture of this.
That's exactly right. Most people with hip arthritis most people are not treated surgically, so at least initially. Most people will try medications like anti-inflammatory, like your ibuprofen, Aleve, those types of medications, Tylenol. Then sometimes we'll offer injections, steroid or cortisone injection in the hip, which can often provide very good temporary relief. We also generally will recommend some kind of exercise program, whether it's through a formal physical therapist or some people still like to go to the gym with a trainer, but where they're working on strengthening the muscles around the hip.
Yes. How long does it take that hip replacement becomes problematic again?
In general, most hip replacements will perform very well for a very long period of time, meaning the patient has had good pain relief, has had good function with the hip. They're able to do a lot of the activities that they want to do. The parts, though, they're artificial. They're man-made parts. We're not born with them.
And between the companies, the parts at all?
Subtle differences. For the most part, they're similar. The types of materials that we use are generally standard across through most of the companies that are out there. And a lot of people think that this implant's better than that one, and in reality, they have to follow very strict standards when they get these types of things approved for use in people.
Now, there's one question that usually comes in. Patient has hip replacement. Now he's going to dental work. Now, because of the hip replacement, do they need pre-medication prior to dental work or any other surgery?
That's a very good question and a little bit controversial because traditionally, in the past, we've told patients, if you have a hip replacement implant and you go to get dental work, we've always advised patients to take an antibiotic prior to that procedure, an hour before, to prevent any potential for infection getting from, say, the mouth or the dental area down into the hip, through the body into the hip, and prevent from creating a hip infection around an implant. Now, that's changed. Those recommendations are evolving. There are some who say now that perhaps we really don't need it at all, that the incidence of hip infection from a dental procedure is so rare that maybe we don't need those antibiotics. I'd say the jury's probably still out, but probably trending in that direction.
Thank you, Dr. Sirounian, about this enlightening information. So in another program, we'll talk about knee replacement.
Okay, thank you.
Now it's time for this week's article. It is magnesium supplementation and arterial stiffness. Magnesium, an important element for many functions in the body, and it is linked to osteoporosis, migraine headache, constipation, PMS, chronic fatigue, and heart attacks. Magnesium is also an important element for blood pressure regulation. Blood pressure is a major determinant of arterial stiffness and is predictor of ischemic heart disease and cardiovascular disease mortality. Studies have found inverse association between dietary magnesium intake and cardiovascular disease risk. Each 200 milligram increment in dietary magnesium intake was associated with 22% lower risk of ischemic heart disease. Researchers from Netherlands evaluated the effects of long-term magnesium supplementation on arterial stiffness. 52 overweight individuals were assigned to receive either 350 milligrams of magnesium or placebo for 24 weeks, and arterial stiffness was evaluated. The end result of this study was daily magnesium intake of 350 milligrams for 24 weeks reduced arterial stiffness. This study suggests that magnesium intake is beneficial for cardiovascular health. Although magnesium supplements are available, it is preferable that you get magnesium naturally from your diet to decrease arterial stiffness and improve your cardiovascular health. Many foods contain magnesium. Green leafy vegetables like spinach and kale are loaded with magnesium. Besides green leafy vegetables, pumpkin seeds, nuts, yogurt, fish, avocado, banana, figs, and dark chocolate have magnesium. So include these foods in your diet. Good health is precious and priceless. Keep informed. For up-to-date medical information, visit AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.